taking all of your video. That's all cut out my part. So, Ann, you're here from Portland, and you had a lap band in 2005.
Right, October 2005. I weighed about 245 pounds at the time. And at first, my lap band, everything went just fine. I lost about 30 pounds.
Yep. So the lap band, a lot of people, when we do these videos, people with the lap band will come to my website and they will just say devastatingly bad things about the lap band patient. They'll say, mine's working fine, I'm doing great, this person is bad or lazy or doesn't know how to use the lap band. Have you heard those negative comments?
Yeah, I've read them all, and at first it's very frustrating because I'm sure if you read a lot of the message boards, people will talk about this crazy amount of weight loss, and like the website I was using had kind of Row Y patients and lap band patients all on the same board, and so the Row Y people were having lots of weight loss, and the lap band people were having kind of slower weight loss, and so it was a little frustrating that I'm not losing this huge amount of weight, that I had 100 pounds to lose and I wasn't losing it, and so it was really frustrating. And the big kind of thing with the lap band that was really difficult is that, and I've heard the same things from other people, is that the things that are healthy and that you want to eat, you can't eat because they're too chunky. They're just too, fruit and vegetables just do not go down well. A lot of, chicken, those kinds of things don't go down really well. So
if you think about it, you're eating into the tip of a funnel, and it's a tiny, narrow tip. And when you try and eat, say, celery or a chunk of apple,
right, yeah,
that's not going to go.
Especially anything with the skin like that,
right?
An apple or that sort of thing.
So you try and eat healthy, but it's challenging.
Yeah. And
then you find out, kind of against your desires, against your real wishes, that junky food will go fine. Right. So potato chips.
Mm-hmm. Yeah. Yeah, and you start having to kind of go around the rules to be able to eat at all, which is one of the rules is to not drink while you're eating, and to be able to get anything down. You drink a little bit while you're eating. So
and so then the other critics come and say, well, the reason she's failing is not because the band is a problem, it's because you're a bad patient. And we hear that. Rules, yeah. Right, you fell. Your surgery up to today. Is that if that's okay?
Yeah, I don't see why not. I'm ready. I mean, I haven't been, as you can see here, I've got access here.
Oh my goodness, what's up with that?
Well, so the thing that really, I guess, kind of the progression of this whole thing is, after years of infertility, I was able to get pregnant 2 years ago, which was just the best thing in the whole wide world. During that time, my band stayed inflated, and my doctor just kept doing close ultrasounds to make sure the baby was growing appropriately, which she was. And so during that time, I was forced down to soups and a lot smaller volume, because as the baby grew, it really put a lot of pressure on my tummy. And so during my pregnancy, I eventually lost 40 more pounds. The bottom line.
So that's good. 70 pounds total.
Yeah, and good. So probably when I was about 33 weeks pregnant, I had started getting a ton of acid reflux, that sort of thing. I couldn't lay down. I couldn't drink Slim Fast and lay down, and without it coming up. And so I went to my doctor and had the fill taken out, so my band was completely empty, and then I could eat normally again. My baby came, and everything went great. Delivery was great. And 3 weeks postpartum, I went back to my doctor and had a fill put in. And my doctor was in Seattle, and I live in Portland. And it was a combination of maybe a little too much fill, maybe I didn't follow the rules correctly. The bottom line is the first day after having a fill, I threw up. And I think that throwing up caused inflammation. It made the stricture even smaller. And so the second day I ate some yogurt with a little bit of the fruit in it that comes in it, just a small amount. That got totally, completely stuck. So I could not eat or drink, and I was breastfeeding. So obviously I needed to take in a lot of fluid, a lot of liquid. And so frantic call to the doctor, come back up to Seattle, had the fill taken out and or reduced quite a bit. And the vomiting that I did that night while waiting to have that taken out, just because I was so thirsty, I would kind of eat some ice, and eventually it would just come back up. And anyway, the bottom line is the band slipped. So even though it was sutured in place, those sutures must have torn when I was vomiting. I didn't even know it. And eventually, a few months later, I tried to transfer care to a doctor in Portland, so I wouldn't be going back and forth to Seattle for fills. And one of the tests they wanted for the intake was an upper GI series, and as soon as I drank the barium and watched the study, I could see the barium going into this pouch that was not a half a cup in size. It was much larger, and I said, I don't think that looks normal, and the radiologist said, no, that's not normal. So anyway, so it turns out
So you have a
kind of
slip band.
a slip band, a major complication. It's not supposed to happen, and it did.
Well, it's a known complication.
Yeah.
It's ideally we don't want any complications, but the band can have a problem, and it could be with, like you say, the vomiting. It can happen over time. The studies from Switzerland show that they're predicting 80% of lap bands will be out by 10 years because this kind of problem happens. Other kinds of problems happen. And since then, you've been so sick.
Oh, it's gotten really bad. So this was first discovered about 6 months ago, and my doctor was amazed at the time that I was still able to eat and drink. And he said, "Are you eating bread?" And I said, "I had a sandwich yesterday." You know, so he said, "Okay, well, I guess if you're not having any problems, you can just leave it in," because I was paying cash, myself to have it taken out. And they wanted $25,000 just to take it out and leave me with nothing in place. Or they could replace the band, which I did not want. So just on the idea that this could happen again, I'd be paying for a third surgery. So we just left it alone. My weight was stable. And then probably within about 2 months or so, my weight started to slowly creep up a little bit. And that really worried me. I thought, I am not going back to 250 pounds. So I just started doing whatever I could with exercise and diet to try to control it. And I felt, though, okay, this is not the best option. I need to research some other options. So that's how I found Dr. Rutledge, and started kind of planning that this is kind of going to be the direction I was going in. Then about a couple weeks ago, suddenly the packet of oatmeal in the morning I was eating was down to about 5 bites. And then about, I guess 10 days ago, I couldn't really eat the oatmeal anymore, so I had Slim Fast for breakfast. That went down fine. Within 2 days, I was couldn't eat or drink anything. I mean, I was done. I think what has happened is there's enough of the stomach has slipped over to this side now that this pouch fills up eventually, even if I go slow, throughout the day, it eventually fills up. And then at night, I had to sleep sitting up on the couch, because if I lay down, I literally wake up with a mouthful of vomit like all night long. I mean, I was sleeping maybe a cumulative 2 hours a night. It was really hard on my husband and our family. So I called Dr. Rutledge and said, I don't know how much longer I can hang on. Like, now I'm just done. Like, I can't do this anymore.
And you have this IV from the ER?
I have an IV now because I went to the ER last Tuesday knowing that I had surgery scheduled for tomorrow. And I had to just make it through basically for 8 days. What am I going to do? I didn't want to keep trying to eat and vomiting, because I was really afraid that other complication you can have that is a very serious one is, if the band twists a certain way, it will cut off the blood supply to the top of the stomach, and you have to have, that's emergency surgery, or you've got to get it out. And in which case I'd be paying for it and being left with nothing in place to help me with weight loss. So I just thought, what, let's not take a chance here. And so I've been getting IV fluids every day for since last Tuesday. So I did have some sips of water.
I think your chances of being a spokesmodel for the band are...
And you know what? I told people all along, it's great, it's wonderful, I would do it again in a heartbeat until this happened. But once it happened, it's pretty catastrophic, really. I mean,
it's the end of the run, so...
It really is. And I obviously do not want another one.
Okay. Well, that's rough. Well, as you've seen in the other videos, we expect to be able to get your band out pretty easy, and we'll give you the MGB. And our plan is to give you about a 6-foot bypass, and hopefully maybe we'll do it today. If we can't, we'll do it tomorrow.
Okay, I'm ready. You ready?
Any questions that you have for me about...
I've done a lot of research on this, a lot of reading, and I feel like I understand the surgery, yeah. And it's good to hear from other post-op patients, I think, to kind of know what their experience was, and I feel like I'm ready.
You'll be able to eat anything you want.
I can't believe that. I told my husband, I said, I can't believe when they say taking a multivitamin, they don't mean a chewable? Like, they mean a big pill. Like, it's a really different way of thinking.
She eats anything she wants.
The whole family's so jealous. I put good things, healthy things out, and then I put out stuff that anybody can enjoy. They're like, you keep eating and losing weight, and we're having the problem.
It's
everything.
I have to say this.
I can't believe it.
It's amazing. We go out, we eat junk food, she gets rid of it, and I gain it. It's like, he made the ultimate digestive system.
Yeah, that's exactly right. But also, even though she eats some junk food, in general, isn't your diet overall kind of healthy?
I crave, yes. I crave, I sit and have a juicy orange. I'm like, who is this? I love the grapefruit juice, salads. And
yeah, I read that a lot from different people.
It's hard to believe it until you start
people I contact
I crave it.
But for you,